Kuzambo, and a very warm welcome to Drungtsho BBS in English. I'm Thong, and today we are here to observe World Hypertension Day, marked annually on May 17th, and it aims to raise awareness about this silent but dangerous condition. So hypertension, commonly known as high blood pressure, is a significant global health issue affecting billions of people worldwide, and Bhutan is of no exception. That's why Drungtsho BBS is here to take part in another global initiative and contribute in our capacity towards a shared cause. And joining us is Dr. Tile Doji, a medical specialist from Gelifo Hospital. Thank you so much, Doctor, for joining us. And to begin with, Doctor, can you please tell us the importance of observing this day and the theme for this year's World Hypertension Day?
Good evening to everyone. Hypertension is a growing problem for many countries and including Bhutan. Measuring BP is a very simple act and often people ignore it, but I'd like to say that as a responsible individual, it is like when you wake up, you look at your phone, how much phone charge do you, the battery charge do you have in your phone. So it's similar to that. You should know your blood pressure status. And this year, the theme for World Hypertension Day is to states that we should measure BP accurately, because it is very important to get your measurement accurate. Control your BP, and you will live longer.
Yes. So, Doctor, what exactly is hypertension? Is it a disease or a condition, or how it is? What causes it?
Hypertension is a disease. It's not a singular disease. I'd like to explain that hypertension causes many other diseases. But to diagnose hypertension, it is very simple. You walk into a hospital or you take any opportunity and measure your BP blood pressure correctly. And with that, if your blood pressure is less than 120/80, it is normal. It means that a person with that much of BP does not have much risk of getting your organs damaged. The second category is that if your BP is more than 130/80, it means that you are likely to progress further, and then you might get a full-blown hypertension. We define hypertension as when you measure your blood pressure, and if it is more than 140/90, then we will say that you have hypertension. Now in this, it is very important to have your blood pressure measured accurately.
Yes. So what are the risk factors associated with hypertension?
Hypertension is a disease that is caused by some of your own behaviors, or I like to say habits. Now the habits include smoking. It is very sad that the number of people who are picking up smoking is rising in the country, and we are seeing younger people picking up the habit of smoking. The second one is doma. Doma is culturally acceptable, and there is an unchecked amount of consumption of doma. The third one is alcohol. Though alcohol causes a lot of complications from head to toe, alcohol is one of the risk factors for hypertension. The next risk factor is your diet. In diet, we say that you need to take a heart-healthy diet, which is less in oil, less in salt. How much of salt are you permitted to take? In a routine Bhutanese household, you might be making 3 meals a day. So for all the 3 meals combined, we recommend that you take only 1 teaspoon of salt. It is the smaller teaspoon, not the normal spoon. And for oil, it's recommended that you take only 2 to 3 teaspoons of oil. That is for all the meals that you are cooking.
So what are some of the preventive measures that people should know to reduce the risk of getting high BP?
If you're a non-smoker, please do not pick up this habit. No matter what no matter what others say, because there are a lot of misconceptions about it. It's helping you in weight reduction and so many other things. These are all not substantiated. There is no scientific evidence to say that smoking will really reduce your weight. Don't pick up alcohol. Don't pick up doma. Now, in terms of diet, reduce your salt, reduce your oil, and then take up a physical exercise, where we are saying you need not have to go to a gym or get a lot of equipment. Now, the physical activity that is helpful for you would be around 30 minutes of jogging, walking, where you have a where you feel that your heart is raising a little bit more, and when you feel that your heart is pounding a little bit and you are sweating a little bit, and that is adequate. We recommend you to do physical exercise at least for 30 minutes for 5 days a week, and that should be adequate.
So, doctor, what about the group of individuals who do not indulge in these activities like smoking, alcohol, doma chewing, and who has a balanced diet followed? So, what do you say about that, La? Why do people get high BP even though they have a good lifestyle, La?
This is a very good question. Many people feel victimized when they are diagnosed with hypertension, and then when they do not have obvious risk factors. Please don't disheartened, because even if you are diagnosed with hypertension, if you are treated and if you get it under control, there's no you'll live a long life. There are very few people who might, without the risk factors, they might get hypertension, but that might be because of some genetic factors, or there might be some silent disease going on in the body, and hypertension might be the first presentation of that disease. But if you look at in the general population, it is only those people with the risk factors, smoking, doma, tobacco, people with less physical activity, who progress to get hypertension.
So, doctor, according to studies, it is said that high BP is one of the main risk factor to developing other cardiovascular diseases and premature death. So, what's the relation between these?
In a person with high blood pressure, that blood with high pressure flows through all parts of your body, all parts of your organs, and you can get complications from head to toe. So that would include, you will get stroke. Stroke means that you are unable to speak, unable to walk, unable to control your bowel or bladder, you are unable to swallow, you are unable to speak. The second complication you will have is that you will have higher chances of getting heart attack, or higher chances of going into heart failure. Now, the symptoms will be, you will have swelling of your legs, you are unable to walk the usual distance you are able to walk, you are unable to climb stairs, you get breathless when you are sleeping on your bed, and these are all cardiovascular events. The third complication that you will get is that you will have kidney failure. And please don't be misguided thinking that kidney disease means that you will have to get dialysis. Patients with kidney disease getting dialysis are those at the very last stage of kidney disease. There are many in our hospital where you have kidney disease, where your renal functions have deranged, but you are still able to carry on with your normal life. So in those patients, when you get these complications, then the chance of mortality, or your chance of dying out of stroke, dying out of heart attack, dying out of heart failure, dying out of kidney disease is very much high in our context.
So, doctor, talking about symptoms, are there any manifestations of BP that people should be aware of?
Hypertension per se does not have any specific symptoms. Yes. Some say that you will have headache, you will have palpitations, lightheadedness, but these are very non-specific symptoms. Yes. This means that in such cases, these symptoms might be because of so many other reasons. Now, in the second category, you might get complications. You might get a stroke, you might get a heart attack or kidney failure, and then you will come to know about the status that you are having hypertension. That is why, from a health practitioner's point of view, we always tell people that take the opportunity to measure your blood pressure whenever the opportunity arises. It can be in any hospital. If you walk into any hospital and say that you want to get your pressures checked, nobody will deny you the opportunity. The second opportunity that you can take is that there are many screening camps that are happening in the town, in your offices, in Melam Chelmos. So take every opportunity and get your blood pressure checked. It is like looking at your phone and looking at how much battery charge is remaining in your body, in your phone.
Doctor, about the diagnosis, how can people living in remote pockets of Bhutan avail the diagnosis services? Are there any programs or services like planned for these individuals?
In terms of health accessibility, people in the rural areas usually live nearby the primary health care centers, and if you walk into the primary health care centers, our health assistant or the health staff there will help you get your BP checked. And many times we have many screening programs that come into villages. If you look into social media, you'll have young group of students, health workers, they go to the villages, they call people and get your blood, give you screening blood pressure measurement. And I'd like to say that no matter whether you are in a rural area or in town, you please walk into any of our health centers or take the opportunity during the screening programs.
Yes. So, doctor, after the diagnosis of high BP, when is medicated?
When you measure your blood pressure, if it is less than 120/80, it means that your blood pressure is normal, and what you should be doing is that you should not be picking up the bad habits of smoking, doma and tobacco, and weight gain. If your blood pressure is around 130/80, it means that you might get hypertension if you don't control the risk factors. And if your blood pressure is more than 140/90, it means that you have hypertension, and then sometimes we have people with blood pressure on the first measurement, it will be like 180/110 or 200. It means that you have frank hypertension. There's no doubt about the diagnosis. If the BP is fairly little bit raised, then you have some opportunity to reverse the condition by doing physical exercise or getting diet under control, or stopping smoking or alcohol. But if your blood pressure is very high, then it means that you need to take medications. It means that your diet control and physical exercise will help you a little bit, but it will not be enough to bring your blood pressure to normal range. This is the condition where your medications are indicated, and then the health worker will tell you that no, this is the time that you need to take the medications.
So, doctor, can you please elaborate more on the administration of BP medicines, because some have these questions revolving whether it's lifelong or it's does it have a side effects? So, can you?
Thank you very much for the question. I'd like to begin by saying that I'll give you some statistics which the World Health Organization country office in Bhutan has given us. It is an estimate, but it is a scientific estimate. It says that in Bhutan there should be around 140,000 people with hypertension.
Yes.
But as of now, in our registers, when we combine all the number of patients diagnosed with hypertension, the number of patients is very less. And amongst those 140,000, it is estimated that 62,000 might have gotten the opportunity to diagnose their hypertension. And among them also, only 33,000 would have got their hypertension treated. And among the 33,000, it is only about 11,000 whose blood pressure is under control. Now, if you talk in terms of percentage, from the population, 66% of our people do not even know that they have hypertension. So this is a very bad state. It means that we need to provide more screening opportunities, and people should also come and participate and get their blood pressure checked. And when you go down, we have only 3.3% of the population who have hypertension diagnosed, hypertension treated, and hypertension under control. This means that though with the free service of healthcare services being provided free as per the vision of His Majesty the King and the Royal Government, we are at a very poor state of control. This means that the majority of our people are day in and day out, they are at a very high risk of getting stroke, getting heart attack, or getting kidney diseases. And for those people, if the health worker says take hypertension medications, they would have given this advice based on a lot of reasons. This means that it is better to take, and taking hypertension medication is not a very big deal. It's a small tablet. You can take it morning or evening, and then it's provided free of cost. And people are worried about side effect. Frankly, as a clinician, I have seen more number of people dying out of stroke, dying out of kidney disease because of not taking medication, than anyone coming to hospital with the side effect of taking any hypertensive medication.
What about the myth or the common conception that it's lifelong, the BP medications?
In the majority of the patients, the medication needs to be taken for long term. I would not say lifelong,
Yes.
because in our clinic, in my hospital, we have several patients who, after getting diagnosed with hypertension, they become very motivated to change their lifestyle. Some stop smoking, they pick up exercise, and then they do diet control, and then they will bring down their weight. And in those cases, we are slowly able to firstly reduce the number of medication, then reduce the dose, and slowly, in some cases, we are able to stop medications. But in majority of the patients, we are able to they are able to get the hypertension under control with regular medication. But in some cases, now you have hypertension, you are still not bothered about cutting down the risk factors, you continue smoking, you continue taking alcohol. In those cases, it becomes the other way. It means the doctor gives you one medicine, and next month you need to take 2 medicines, and the next month you need to take 3 medicines. So in such situations, as important as it's to take the medicine, it's important to control the risk factors. And if you control the risk factors, it is possible that there's some possibility that you will be able to stop your medication. But taking medication is of no harm. Yes. This is an internationally approved medication, and there are millions of people around the world who take the benefit of taking hypertension medications.
So hypertension is curable, doctor?
Because this is, in majority of the patients, it is very difficult to cure. We say that our target is to control, and in very small proportion of patients, I'll be honest, we are able to taper down the medication and stop the medications.
Yes. So how often should individuals go check their blood pressure?
Like I gave you the numbers earlier, even if you are diagnosed with hypertension, and if your hypertension is not under control, you are still at a risk of getting those complications. Therefore, there are 2 points. First is to get it diagnosed, second is to get it under control. To get it under control, you need to visit the hospitals. We tell the patients to visit every month, so that when you come for the next month's visit, we are able to measure your blood pressure, and then if the medication is too high, we will reduce the dose. If the medications are inadequate, we will increase the dose. So it gives you a very good opportunity. So as far as possible, please visit your hospital every month. Now, when you visit the hospital, I understand that it takes a lot of time. You need to wait in queue. You are wasting. Sometimes you need the problems with transportation. But the Ministry of Health and the National Medical Services has rolled out a lot of other initiatives. For example, in Thimphu town, there are many Tromde health clinics. Now, it's there in Changjiji, Depsi, Semtokha, Hejo, Dechincholing. Princeling has recently started a Tromde health clinic. It means that for hypertension, it's easier for you to visit your nearest hospital than to visit a very crowded hospital. And the quality of care and the number of medicines that you receive from the hospital nearby is the same as you visiting a big hospital.
So, doctor, are there any alternative or complementary therapies for managing hypertension other than lifestyle modifications and medications?
I am aware of some herbal combinations being used by patients in the name of getting the hypertension under control. But for an allopathic medicine practitioner like me, we go by what is called as scientific evidence. There needs to be research done, and the research should prove that this medicine reduces, if you take this medicine at this dose, it reduces the blood pressure by this much. Unfortunately, there are no such research being done, and no such evidence that favors alternative medicine currently that are currently available in Bhutan.
Yes. So, doctor, it is said that BP can lead to cardiovascular diseases. So, are there any chances of other NCDs causing blood pressure?
hypertension is not a singular disease. If you
Yes.
get hypertension, your chances of getting diabetes, stroke, kidney disease increases. It is again the reverse. If you have kidney disease, it's likely that you will have hypertension. If you have diabetes, it is likely that you will have, if you have diabetes, it's likely that you might develop hypertension over the course. That is why anyone who is diagnosed with a non-communicable disease, so it needs to be evaluated or screened from time to time for other complications. And if you have one disease, it complicates, you are having higher risk for others, and then this will compound and result in higher chances of you getting mortality.
Yes. So, doctor, are there any? I think there sure is side effects of the medicines that people take for BP. So, if there are, what are those?
The medicines that we get in Bhutan, first of all, are procured by the government through a very rigorous system of quality check.
Yes.
And all the manufacturers are actually evaluated by Bhutan Food and Drug Administration, and then we need to get approval. The manufacturer needs to get approval to bring the medicines into Bhutan. It means that whichever medicine is coming into Bhutan, they are quality assured and they are coming from very good companies. The second is that, of course, there are few side effects, but as a clinician, I see hundreds of patients in my hospital, very few of them getting side effects. It means that there are, majority is that there are more benefits of taking the medications than the side effects. Now, if you have side effects, we will be able to pick it up when you visit your doctor. For example, if you are getting one medicine and when you visit your doctor in your next visit, you should tell your doctor, you should speak to your doctor or your health assistant and say that, okay, I'm feeling this, I'm having new problems, and then they will be able to identify and really identify and say whether it is side effects. Because, for example, now you are started on a medication and you are having some unusual symptoms. They might not exactly be side effects, they might be incidental, they might be because of so many other reasons, and then it is just a coincidence that the medicine was started and you are starting to blame the medicine and you stop the medication. This is very unfair for the medicine, I mean.
Yes.
And it is always beneficial to take whatever medicine that is prescribed to you.
So, doctor, what would be the one advice that you'd give to the people who suffers from this combination of non-communicable diseases?
The Royal Government of Bhutan and the Ministry of Health has recently enrolled, now not recently, for past decade has been enrolling the package of care for non-communicable disease. It used to be called as PenHearts before, and since 2021 we are calling it the Service with Care and Compassion package. Now, in this package we are trying to address two things. First is to provide NCD care at the doorstep, and second is to address both the risk factor and control the disease. For example, in SCCI we tell people not to smoke, not to consume alcohol, and for those patients who are already addicted, who are having addiction, we provide measures to come out of addiction. That's one initiative. The key message of the SCCI program is that for NCD care, the medicines, the follow-up, the testing, majority of them are available at the nearest hospital. Now, there are instances where people travel all the way from Paro to Thimphu to get the medications refilled, thinking that the medicines given in GDW in Thimphu hospital is of better quality or of higher order. It is not true. In Bhutan, in our health system, it is fair and equal for everyone. So, for non-communicable diseases, with the rolling out of the SCCI program, it is good enough, or the quality of care that you will get from Paro hospital or any primary health care center is as good as that you receive from a bigger hospital.
So, what services are included in the NCD care at doorstep?
For the SCCI program, it includes your screening for addiction, then the de-addiction processes, healthy lifestyle, heart-healthy diet, and we also we screen for diabetes, hypertension, and whoever is getting diagnosed with those diabetes and hypertension, they are registered in a Google form and we follow them up. Now, if the patient does not turn up for next month for review, we have a system of recall where we call the patients and try to bring them into fold. and this has been rolled out in all the 20 districts, and in some of the districts it has brought tremendous benefits by detecting more number of patients with hypertension. Now for the 13th five-year plan, the ministry has through the SSI program has made an ambitious target to screen 50,000 people and then bring 50,000 of them under medication.
So doctor, I think we have covered almost all the topics under hypertension. So if I missed out on any topics under this, you may go on and have a few minutes on it.
Hypertension is a very common condition, and I urge all people to take every opportunity that they get to get their BP measured. It can be in their offices, when there are screening programs, in the hospitals. Now the next part is to avoid the risk factors. Stop smoking, stop alcohol, stop doma. Adopt a healthy lifestyle. You do moderate physical activity for 30 minutes a day for at least 5 days, and take heart healthy diet. And for those who are diagnosed with hypertension, if any health worker tells you that you have hypertension and you require medication, they are telling you with your benefit, for your benefit, and please it is advisable that you take the medication, because there's a lot of more benefit of taking the medication than not taking the medication.
Yes, thank you so much, doctor, and thank you so much for your time and your knowledge on this hypertension. And today we dedicated this episode to hypertension, joining the world in raising awareness about this condition commonly known as high blood pressure. And with Dr. Tile, we discussed about some of its causes, symptoms, diagnosis, and prevention and treatment. And that is all for today. Thank you so much for joining us, and until next time, keep track of your blood pressure level. Thank you so much.